Let's talk about the exams then. About the Fachsprachprüfung, first of all, it's a medical German exam. That means it is on paper, they don't want to know your medical knowledge. They just want to see your medical German, the vocabulary, the combined sentence formation, the understanding, if you can understand what the patient is saying, if the patient can understand what you are saying. So in this exam, there is no real patient. There are like three doctors will be there who will be your examiners. From that, one doctor will play as a patient. You will know that this is a doctor and he is going to play as a patient. So he will, when you go, this is exam is a 1 hour exam, 23 sections. One is history taking, another is documentation, and third is Arztgespräch, that is the doctor-doctor communication, that means case presentation basically. Some centers also have translation from Latin to German and German to Latin in the program, like in the exam. So, and some places also have a phone call, like when you are in during the call during the exam, you will receive a phone call from somebody who will be pretending to be a nurse and will be telling you some situation of the ward. Okay, that okay for this patient, the kalium VAT, for example, the potassium level is say 2,5, and what do I do? So that time you have to like show appropriate response to that. That okay, if the nurse tells you, or somebody says that okay, doctor, in this ward this patient has fallen down in the bathroom, now what do I do? So they see that if you understood what was told to you on phone, and what did you say, like how did you communicate, did the nurse understand what you said? So then, as I said, in this exam they don't go on details of the medical knowledge. If you give the right medicine, for example, potassium level is low, so did you know that okay, you have to give calcium potassium chloride for that, or how much doses you have to give, that they don't check. That they check in the Kenntnisprüfung exam, that is a knowledge test exam, that how, which dose you said, how you said it should be given, and all those instructions. So, but here they see that did you understand what was told to you, and did the nurse understand what you said to them? So these are so basically three things: doctor-patient communication, documentation, that is you have to write the entire thing that you have to talk to the patient, and third is the Arztgespräch, that is the doctor-doctor conversation. So and plus these small things. So this is the pattern for Fachsprachprüfung exam. The exam preparation usually takes 2 to 3 months time. Okay, depending upon one's previous knowledge of German, previous medical knowledge, obviously differs from person to person, how intensively one prepares for this exam. So it varies, but in general, 3 months is a okay time to prepare for this Fachsprachprüfung exam. This exam it is conducted by the Erste Kammer, that is the medical council. There are 16 medical councils. Some private players also conduct this exam. Okay, like for example, TELC conducts this exam. In some states, the state does not conduct this exam. They have given it to private institutes. Like for example, in Hessen, Behrami Institute is there. So the state says over there that okay, we don't have time to conduct this exam. This is our trusted partner, Language Institute. You go there, you take the exam. If they pass you, we accept you. But the problem with these is that this is accepted only in that state. Like for example, TELC is accepted only, I think, in 2 states, Saarland and one more state. Okay, so initially it was 3-4 states. Now every state has started taking their own exams, and they have reduced the like acceptance of the TELC exam. So that's why I always recommend don't go for TELC exam, because then you will be stuck in one state only. So go for the state medical council's exam. And that way, if you pass that exam, that is recognized in entire Germany. That means that before approbation, if you feel that okay, I have to change my job and change my state, you can use that exam and say that okay, I have passed the Fachsprachprüfung exam and move to another state. Okay, so that is one thing that I recommend. Some people want still to, because TELC exams are easier. Okay, so some people still want to take TELC exam, and I mean everybody can choose, but there are always pros and cons. Okay, so that was about the exam and the duration. I mean the dates of conducting. You will get an appointment when you send your application. Exams are conducted every day. Okay, so every day, like 4, 5 people, 6 people will be invited for the exam, or you will have different appointments. Like as I said, it's only 1 hour exam, so they can have multiple sessions per day. So there are branch like the the department in Instagram with medical council, they are responsible only for taking exams. So full day their job is just to conduct exams. So the exams are every day. Uh, but like you will get an appointment depending upon when you have sent your application and everything, and you will have to go for that appointment. It usually after your deficit bescheid, once you send your application and everything, okay, you'll get deficit bescheid after a few months time. So in that deficit bescheid, they will ask for more documents, like or maybe updated documents. They'll say update your CV, send police clearance, send this and that, like small things they might ask you, or whatever things are unclear to them in your case, they will ask you for that. So once you submit those things, then maybe in couple of months time you will get an invite. They will also give you, along with the deficit bescheid, they will also give you a form where that is the registration for the Fachsprachprüfung. Okay, so once you fill that form, that registration form will be sent from licensing authority to the medical council. There are two authorities in play here. One is the medical council, which is taking the exam, and one is a licensing authority, which where you will be sending your documents to. So you will not be like in contact with the medical council. You will be contact with the licensing authority. So licensing authority will send your application to medical council, and medical council will then invite you for the exam depending upon the waiting list over there. And the same plays for the Kenntnisprüfung also. So you will apply to the licensing authority, and licensing authority will tell that medical council that okay, this candidate wants to take Kenntnisprüfung, and they will arrange that for you then. Okay. So the pattern is the same. Pattern for Kenntnisprüfung is also the same, only the level of questions changes. There, they don't just want your language to be good, they want knowledge also. Like they will, there is an additional theory viva over there. That apart from these case presentation, you will sit there and they will ask you theory questions, and there that can go in any direction. That is like basically how we have in India, like viva exams. Okay, they will ask you general surgery, internal medicine, orthopedics, trauma. So in Kenntnisprüfung, you will be also asked about pharmacology. So little bit anatomy, little bit physiology, little bit like relevant things they will ask. Not too much in detail about physiology, but wherever it is matching, like they can ask you a little bit extension of internal medicine into physiology, like why does this happen or that happen, like that. In oral exam, that's a problem. It can go in any direction. You never know what direction it will go.